If you have a question, raise your hand. We'll try and get to as many people as we can before our time expires. But I'd like to go to the lady in the back there, the black and white coat. Yes, ma'am.
I can't agree more that pouring money onto a problem, if the money isn't spent fixing the problem, is a bad idea. But what I have seen in our state is millions and millions and millions of dollars to be poured into a Medicaid agency where there's a hole in the bucket and the money isn't going for its intended purpose. When we had the transition, there was a number 2 person at HHS who went with a private managed care company, and we had news reports that that company, that managed care company, overbilled Medicaid by $10.5 million. I've gotten a FOIA request that says HHS has not managed those managed care companies. We've got a USC report that shows that when former Governor Sanford brought managed care in for children's Medicaid, there's a MUSC report that shows that it cost, I believe, $2,000 more per child with the managed care. So what I want to know is, the legislators are going to decide whether to bring it in or not. What is HHS going to do about these holes in the bucket where the money is not being spent on the intended purpose? And are we going to get audits and do something about the Medicaid fraud that is just rampant in our state?
All right, we'll have a minute to respond from Commissioner Cagney and then Attorney Greenwald.
I mean, those are all great problems, and those are all problems that Governor Haley and I exposed in the agency. We exposed that $10 million overpayment to the managed care company. In fact, we've taken out an annual $40 million a year from the managed care companies to put back into providers and to put back into services because we thought they were being overpaid. And this year, we've put $16 million at risk for better performance on these numbers I was quoting to you. Next year, we've got $24 million at risk for performance. And so I think what we're trying to do is exactly what you're talking about, is plug that hole in the bucket.
How do you do that?
Well, I think we've already done it by better managing. It's pretty simple. I mean, you got to manage these programs well. And so when we talk about pouring more money into them, that's what I'm saying, is the health system is not managing these dollars well. And it's got to manage them better. If we can manage them better, if we can manage them better, we can do things like we did last year and ask for $30 million more to bring on 50,000 kids that we did last month. In 1 month, 50,000 new kids into the program. And so we can improve the way we operate the program, and then we can get more people insurance. And so that's really our argument. Massachusetts decided to do it the other way. They said, well, let's expand first, and then we'll get cost control under control later. Costs have gone through the roof, and now they're trying to get it under control, and they're having some real problems. Again, the hospital agency, or the hospital administration there is working against it.
Thank you.
I think there's a great question, a couple of things to say about it. The Affordable Care Act actually includes a number of provisions to try to deal more effectively with fraud and abuse. In fact, this year and last year, the highest amount of recoupment of fraud and abuse dollars in history. So we're moving at least in the right direction. It's also important to know that of fraud and abuse, only 10% is associated with consumers. The overwhelming majority are the insurers, their employers, and frankly, providers. So I think one thing should be clear is we can't blame the beneficiaries of health insurance. Number 2, the administrative costs of the Medicaid program are 7%. That's half of the administrative costs for private insurance systems. So the Medicaid system itself actually is effectively run. It is the waste and the fraud and abuse I completely agree with. I also agree with one of your big proponents that you proposed is the value-based insurance design. I really do believe we need to set up a system where we pay for high effectiveness, low cost services and have much less waste by paying for low effectiveness, high cost services. But just be very clear, this is exactly what the whole death panel kind of debate was about during the Affordable Care Act. We really don't like and are afraid of value-based insurance design because it means some services will become intentionally harder to get and out of reach based on value. So we need to make some really conscious choice here about whether we truly believe in reducing waste, being very effective in how we spend money, making sure we have a strong administrative program like the current Medicaid program, and absolutely we need to deal with fraud and abuse. But again, don't blame the consumer because they're a very, very small part of the problem.
Thank you very